issue with health IT that I think is fascinating is why we are just so far behind. I mean, we're not just behind the rest of most of the other sectors of the U.S. economy that have aggressively deployed IT to cut costs, improve quality, to be more customer focused. We're behind many, many other countries. And as we saw today on our panel, particularly with the two doctors presenting, these are not just issues of cost. These are issues of people dying, people with very bad care and really serious problems because we just haven't gone forward on this. And it's not like we're sort of saying, well, we need a National Science Foundation program to invent this technology. Technology is there right now. And what we need is we have an industry, if you will, a healthcare industry that is just not structured and oriented in a way for rapid adoption of this technology. You've got a lot of small practices. You've got a lot of incentives that are going the wrong way. Think about, again, many other industries have deployed IT to dramatically boost quality. So manufacturing, for example, will have many sectors in manufacturing. They'll have sensors. They'll be able to detect very minute differences in quality of, for example, on a car, how much the gaps are between the fender and the other part of the body, for example. Health IT the healthcare industry in the U.S. is striking in its absence of these kind of quality measures. This is an industry that is largely a craft industry, if you will, sort of a guild almost. We have individual craftspeople. They learn their craft. They go out. They set up a shingle. They have their medical books on the shelf, and they practice their craft. It's not. Now, we used to have that in many sectors of our economy, but what we've done is we've transformed into a more sort of knowledge-based industrial model where we're able to use these tools and these techniques to really improve quality. We haven't done that in healthcare. Now, if we did, one of the things we'd know, for example, is how many mistakes this hospital is making, or what kind of, using an issue of standard of care that Dr. Lotman referred to. They did a procedure where they started measuring how many doctors were doing a very simple thing you should do with, I'm not a doctor, but this is what he tells me, diabetic patients, you little probe their foot with just a little piece of wire, and do they feel it? Something like 30% of the doctors were doing that, and all they needed was a piece of wire. Guy went around, gave everybody a piece of wire, went up to 70%. Now, part of that, as you saw from the Marshfield Clinic, is because that wasn't being measured in a way that was where you could see it, and you could say, hey, you as a doctor are not doing this, but all the other doctors are. If we had some of that feedback mechanisms, I think we'd do a lot better. Well, I think at the end of the day, if we're going to do this right, we have to have a system that has very strong incentives and both carrots and sticks, if you will. I think if you sort of just let the market work, besides the fact that we don't have a market in healthcare, by and large, we're not going to get there very fast. And so the proposals that we made in our report, for example, to require doctors to give a patient a record electronically, that would spur this adoption if you did that. The federal government is the biggest purchaser of healthcare services, and if they simply said, by the way, if you're going to be a provider to a federal employee in the plan, you have to participate in these electronic patient record systems, and you have to make sure that your doctors participate in them, you would see a very dramatic change fairly quickly. So unless you really make some very strong incentives, I think the inertial factors that doctors have, it'll take a long time to overcome that inertia. Now, if you did these incentives, I'm convinced we could have universal adoption within 3 or 4 or 5 years. It's not hard to do. It's frankly easy to do. It's just people don't put the effort and time into doing it.